What public emergency care is available for Americans in Asia? Imagine you're exploring a bustling street in Bangkok or Tokyo when suddenly you feel unwell or get injured. What happens next? Knowing what emergency care options are available can make all the difference in a crisis. In most Asian countries, public healthcare systems provide emergency services to everyone, including foreigners. These services are funded by the government and are available at public hospitals and clinics. If you need urgent help, you can dial a local emergency number similar to the United States. For example, in Thailand, the number is 1669. In Singapore, it is 995, and in Japan, it is 119. These numbers connect you to emergency responders, who will send help regardless of your nationality. Public emergency care generally covers life-threatening situations, serious injuries, trauma, and sudden illnesses. In cities, you will find hospitals with emergency departments staffed by trained medical personnel. However, the quality of care can vary. Major urban hospitals tend to have better equipment and more English-speaking staff, but wait times can be longer. In rural areas, facilities are often basic, with fewer resources and limited language support. Costs for emergency care are usually low compared to the United States, but you should be prepared to pay upfront. Many hospitals requiring payment at the time of service, especially in emergencies. While some public hospitals offer affordable care, complex treatments or extended stays can add up. Americans living abroad often find that public health care is inexpensive but may not include all the comforts or privacy they are used to. Language barriers can be a challenge during emergencies. While responders will assist anyone in need, explaining your symptoms or understanding instructions can be difficult if you do not speak the local language. In larger cities with sizable expat communities, some hospitals have English-speaking staff, but this is not guaranteed. It's helpful to learn basic medical phrases in the local language or carry a translation app. Most experts recommend that Americans abroad carry international health insurance. Public emergency care may be sufficient for basic needs, but private insurance can give you access to private hospitals, doctors who speak English, and services like direct billing and medical evacuation. If your condition is serious or requires specialized treatment, private facilities often provide a higher standard of care. Knowing the local emergency numbers and keeping a list of your medical conditions, medications, and insurance details is a smart move. If you have a chronic illness, bring enough medication to last your entire stay, as local pharmacies may not stock your specific prescriptions. In remote areas, you might need to be transported to a larger city or even another country for advanced care. Having insurance that covers medical evacuation can be life-saving in such situations. The difference between urban and rural health care can be significant. In cities, you will find hospitals with emergency rooms, specialists, and some English support. In rural areas, clinics may only handle basic emergencies, and serious cases often requiring travel to regional hospitals. This can mean long waits and transportation delays, so living near a city can improve your access to emergency services. Access to emergency care is just one part of living abroad. Many Americans consider healthcare quality when choosing where to settle. Some countries or cities offer excellent medical services, even if the cost of living is higher. Others prioritize affordability and accept more basic healthcare options. Being prepared with knowledge, insurance, and a plan can help you stay safe and healthy during your time in Asia.